Hello, this is Craig Dean with the MyHealth Access Network, and I lead our community analytics project. And I'm here to talk to you today about how at MyHealth we're going to leverage business intelligence technology to help improve our community's health. So, I want to talk to you today about what we refer to as our advanced analytics platform. And basically, with the advanced analytics platform, what we're attempting to do is take all of the healthcare data that is collected by all the providers around our community about the patients in our community and make that data more easily accessible and more useful for the healthcare providers so that they can leverage it better to add efficiencies to the healthcare system and improve the quality of the healthcare they deliver, and of course, most importantly, improve the health of our citizens within our community. So let's talk a little bit about what business intelligence actually is. That's the type of tools we'll be using to help our community better leverage its data. In a basic healthcare organizations, you're going to have a lot of different, what we would call applications collecting data, things like electronic medical records or a practice management system or even your HR and finance systems. You may be receiving some payer data. You may have disease registries, so lots of different systems collecting data. But often when it comes down to the leaders in a healthcare organization being able to access the data they need to make decisions, oftentimes the data they need is not easily accessible or not available in the format they need, and therefore they can't necessarily move forward like they would like to. Well, to give a very basic definition of business intelligence, what business intelligence tools do is they unlock the data in those applications and make them available to the people who need them. So here's a long definitions of business intelligence. I'll read it to you real quick. A set of methodologies, processes, architectures, and technologies that transform raw data into meaningful and useful information used to enable more effective strategic, tactical, and operational insights and decision making. The most important part of that definition is underlined here. Transform raw data into meaningful and useful information. So you see here we have that diagrammed out. Take raw data, transform it to meaningful and useful information to facilitate effective decision making. That's our goal with the community analytics platform. So taking a look at where we hope to enable our healthcare providers to get to, we want to look at what evidence we'll be looking for as we seek to help our organizations or in our community be more mature with their use of business intelligence tools and leveraging data. First goal will be that everyone can easily access the data that they need when at the time that they need it, and that it would be in a format that's useful to them. And additionally, not only would they have access to the data they need, but also the ability to explore for answers to subsequent questions. They may see a data point and then have additional questions. We want to give them the ability to explore the data and find the answers to those questions. Secondly, we want all of the organizations in our community to be able to collaborate around trusted facts. And what that means is that as leaders come together to make decisions in their organizations, we want the data that they review to be trusted, that they could be ensured of the quality and accuracy of it so that they can have confidence in their decision making. And then third, we would say we want all of our community members to be able to move forward with their objectives and the projects that they are coming up with in order to improve the quality of their health care. We want them to be able to move forward without access to data being a roadblock. Oftentimes in organizations, as they come together, they may have ideas of different projects they want to move forward with, but unfortunately a lot of times they can't move forward because they lack the data they need to make decisions. So we want to see that roadblock go away.